which is Delta and Omicron combined, is starting to spread across the globe. Charles Croucher is with me in the studio tonight with the details on so-called Deltacron.
They had a baby?
Deltacron was first detected in France, found circulating in several regions of the country since early January this year. Now, low levels have also been identified in Denmark and the Netherlands, with recent reports of cases in the United Kingdom and in the United States. The variant is a combination of Delta and Omicron, and as a result of both infecting the population at the same time and their cells reproducing.
In some countries, the wave of Delta had already passed, so circulation was at a low level. But in other countries, in Europe, for example, Delta was still circulating at quite a high level.
Snake on a pole there behind you?
The World Health Organization says the fusion, referred to as recombinant, is expected, and it's not the first and won't be the last.
How would
but
you
the
know
question
that?
is, should we be worried about it?
We have not seen any change in the epidemiology with this recombinant. We haven't seen any change in severity, but there are many studies that are underway.
The virus's surface protein, known as its spike, comes almost entirely from
If you
Omicron,
turn that
so it's
spike a
thought that
certain
global
way, it
immunity
kind of looks
against
like...
Omicron through vaccination and
anyway,
infection
these should
work
be
just
effective.
as well
Should
against
be?
Deltacron. New South Wales
Put your
Health
faith in
says
that.
so far, Pete, no cases of Deltacron have been identified here.
Good evening. We're being warned tonight to brace for COVID
Warning,
numbers to double or worse within just the
maybe
next
you're
week.
just
And the Premier has ordered our hospitals to get ready.
But it's still likely requirements for contacts to isolate will reduce as the new government overhauls the way in which COVID is managed in our state.
I think so.
He's moved into his new office, and for the first time, Peter Malinauskas was on the other side of the lectern as Premier, with a clearer picture of the COVID battle ahead.
Case numbers, even with current policy settings, are set to escalate in a rather significant
Sucks that your name is Peter.
New modelling
That's my
shows
brother's
that by
name.
this time next week, cases could surge from today's number of 3,686 to between 8 and 10,000 cases a day. Within a fortnight of that, hospital numbers could again be back between 2 and 300 people.
We've got an educated population when it comes to the pandemic. And
Put your
people
stupid
understand
hand
that, of course,
out.
the hospitalisation number remains the key one.
So he's directed hospitals to find more capacity now in preparation.
Empty hospital bed.
Carefully at making sure that we can deal with all of those.
So scary though.
Our Chief Public Health Officer says the
By the
sharp
way, your signer
increase in
sucks.
cases is being
I'm
driven
the
by the
best.
lifting of major social restrictions.
Oh no,
2
they
weeks
partied.
ago,
Now we gotta
the
punish
more
them.
transmissible Omicron variant, and the booster shot take-up still sitting below 70% of those eligible.
We were looking for much more like 80 to 90% of people having had that third dose.
The Premier's ordered an urgent review of how SA's booster program can be sped up, because as cases rise...
Unfortunately, the expectation is that we do have an increase in the number of deaths as well. But again, that third dose of vaccine is life-saving.
And yet,
Big-ass
isolation
liar.
and quarantine requirements could soon reduce,
How
because a
stupid
rising
they
case
look.
numbers will likely
Can you
see
imagine-
South Australia's stringent close contact
stupid they
rules
look.
again cripple business.
Morons.
The Premier today disbanding
Oh,
the
Manly,
COVID-ready
Manly.
committee.
Yeah, look at all
Key
these Manly men.
recommendations on the state's next
Afraid of the
steps
air.
will now instead be
Oh,
made
there's
by
a
an
Manly woman
emergency
too, if that is a
subcommittee
woman.
of Cabinet.
National consistency should be something that we all gravitate towards as we move through new phases of COVID-19.
That Emergency Management
brother Pete
Council
would
will
kick
meet
your
for the
ass, by the
first
way.
time on Friday
Look
morning.
at her
It'll be
dress.
chaired
I'm
by
just
the
saying.
Premier
I don't know if that's a
himself
dress or a
and
shirt. It
include
looks like a
new
dress.
ministers who'll be sworn in the day
Did they
before.
do that?
It is
They did.
expected
They did that on
will
purpose.
build a case to relax
Makes
isolation
it
rules,
look like
and
it. Anyway,
Professor Nicholas
we need
Spurrier
more
has indicated that it could have health support,
negativity.
but it will still be the police commissioner who makes
Titty
the
look like
final decision.